Hello friends, today I will be discussing about the basic principles of MRI. MRI stands for magnetic resonance imaging. What is magnetic resonance imaging? This is an imaging modality that uses non-ionizing radiation to create useful diagnostic images. X-ray uses ionizing radiation, but MRI doesn't uses ionizing radiations. In simple term, we can say that MRI scanner consists of a large powerful magnet board in which patient lies and the scan is taken. How this is done we will discuss further, but we have to also know that why we use magnetic resonance imaging. It provides excellent soft tissue contrast resolution. That means सॉफ्ट टिश्यू जो हमारा शरीर में है उसे हम अच्छे से देख सकते हैं एमआरआई इमेज में इन कंपेयर टू एक्सरे और सीटी। एक्सरे और सीटी में हम बोन को अच्छे से देख सकते हैं, बट एमआरआई में हम सॉफ्ट टिश्यूज़ को बहुत बढ़िया से देख सकते हैं। इसके अलावा और क्या फ़ायदा है इसमें? It has the ability to obtain direct, transverse, sagittal, coronal and oblique images regardless of the plane, and all the MR images are presented as thin slices similar to those CT, but without any superimposition of overlying and underlying tissues. That means there is no pathology misses. And in CT images we see sagittal and coronal images are reconstructed from a set of continuous slices, but in MR images are obtained directly from accurate net magnetic resonance signal rather than reconstructed from a slacked transverse images. So further we can know about the parts of basic principles rather. So first it can be divided into 4 parts. So the patient preparation and the excitation of the RF pulse, and then a spatial encoding and then signal acquisition. So coming to the patient preparation, the patient is placed in a board of magnet, that is the MR scanner. We can see previously that you can see the MRI machine. This is the large gantry here you can see, and this is the table where the patient lies, and the machine stays here stationary, but the table will move inside and the scan will be taken. So how it is done we can know with next slide. So the patient is placed on the table on the scanner, and then the proton in the body, in our body, the nucleus of hydrogen possesses an intrinsic magnetizing कॉल स्पिन. हमारा शरीर के अंदर जो हाइड्रोजन है, हाइड्रोजन प्रोटॉन है, सो वो प्रोटॉन अलाइन नहीं होता है, मतलब इधर उधर, मतलब उसका जो डायरेक्शन इधर उधर होता है, लेकिन जब वो मैग्नेटिक फील्ड के अंदर होते हैं तो वो अलाइन हो जाते हैं दोनों तरीके से. एक तो पैरेलली, किससे पैरेलली? वो जो मैग्नेटिक फील्ड है उससे पैरेलली कुछ संख्या में हो जाते हैं पैरेलली, और कुछ संख्या में एंटी पैरेलली हो जाते हैं. जो लोग पैरेलली होते हैं उसके एनर्जी लो होते हैं, और जो उसके अगेंस्ट में जाते हैं मतलब एंटी पैरेलली होते हैं, अलाइंड होते हैं मैग्नेटिक फील्ड से, उसका पावर ज़्यादा होता है, मतलब वो हाई एनर्जी वाला प्रोटॉन है. सो द स्पिन मैग्नेटाइजिंग वेक्टर possesses around the magnetic field at a frequency called Larmor frequency. This is the most important here. Larmor frequency as exam prospect also. This is important. We will know about Larmor equation here. So this is the proton you can see in the images. The proton rotates in after we give the RF pulse, the radio frequency pulse in the machine, MRI machine. So the proton that aligned with the magnetic field started to rotate in its axis. You can see it is rotating The path it's rotate is called the precessional path, and the process is called precession. So the equation you can see omega 0 equal to lambda into b0, where omega 0 is the precessional frequency and the b0 is the magnetic field strength of the magnet, and omega is and the gamma is the gyromagnetic ratio. So now we have to know about these terms also. That is precessional frequency. So precessional frequency, we can say the each hydrogen nucleus that makes up what we can say the net magnetic vector is spinning on its own axis, and the influence of the magnetic field produces an additional spins or wibble of net magnetizing vector around it. So this is secondary spin is called the precession. We can see in the image also, and it causes magnet moment to follow a circular path. You can see here it is following a circular path, and it is called precessional path. The speed at which it rotates is called the precessional frequency, and the precessional frequency we can know here is given by omega 0. That is the Larmor equation here. So this gyromagnetic ratio is also important. That is that expresses the relationship between the angular momentum and magnetic moment of each MR active nuclei. So now coming to excitation. So the excitation of proton is very important here. How it excites during the image acquisition process, a radio frequency pulse is emitted from the scanner when the patient is situated in the table, and the table goes inside into the machine, and then the radio frequency pulse is emitted from the scanner, and when turned to the Larmor frequency, the RF pulse is at resonance and creates a phase coherence in the precision of all proton spins. When the RF pulse is given, the proton spins and it created resonance. What is resonance? A phenomenon that occurs when an object is exposed to an oscillating perturbation that has a frequency close to its own natural frequency of oscillation. This process is called resonance. So when the duration of the RF pulse is also chosen in such a way that it tilts the spin magnetizing perpendicularly to the magnetic field, and when receiving coil is put in the vicinity of the tissue, the transverse magnetization that still rotates as the Larmor precession will generate an electric current in the coil by Faraday's induction. This is the nuclear magnetic resonance signal, that is also called NMR signal. And for resonance of hydrogen to occur, मतलब resonance होने के लिए the RF pulse of energy at exactly the Larmor frequency of the hydrogen net magnetic vector must be applied. So जो एनर्जी चाहिए बस वही देना है, RF पल्स वही एनर्जी में देना है आपको, तभी वो लार्मर फ्रीक्वेंसी से मैच करेगा और उसमें स्कैन होगा. The application of an RF pulse that causes resonance to occur is called excitation. This is the what we are here in the screen. अब हम लोग यहाँ पे यही बात करने चाह रहे हैं कि the application of an RF pulse that causes resonance, जो प्रोसेस रेजोनेंस करने के लिए हमें मदद करता है उसी को हम बोलते हैं एक्साइटेशन. एंड ये एक्साइटेशन होता है RF पल्स देने से. तो हम RF पल्स दे चुके हैं और यहाँ पे एक्साइटेशन चालू हो गया और यहाँ पे अब रेजोनेंस भी हो गया. तो अब रेजोनेंस के वजह से क्या क्या हो सकता है, तो रिजल्ट ऑफ रेजोनेंस here comes. So the result of resonance, we can say the NMV, net magnetic vector, moves out of alignment away from B0. तो रेजोनेंस के वजह से जो अलाइंड होता है मैग्नेटिक वेक्टर वो अपने जगह से आउट ऑफ अलाइनमेंट हो जाता है मैग्नेटिक फील्ड से. And then the balance between the low and high energy population resonance causes the NMB to no longer lie parallel to the B0 and ये अब पैरेलल नहीं होते मैग्नेटिक फील्ड से, ये अब एंगल करके रहते हैं. एंड द जो एंगल होता है NMB का, उस एंगल को हम फ्लिप एंगल कहते हैं. And the magnitude of the flip angle depends upon the amplitude and the duration of the RF pulse. हम कितने रेडियो फ्रिक्वेंसी पल्स कितने दे रहे हैं उसके ऊपर निर्भर करेगा हमारा जो फ्लिप एंगल कितना होगा. तो B0 is termed the longitudinal axis plane or plane. The plane at 90 degree to B0 termed transverse plane. And the plane that is lie parallel, that is termed as longitudinal plane. So the flip angle of 90 degree, the nuclei are given sufficient energy so that the longitudinal net magnetic vector is completely transferred into a transverse NMV that rotates in the transverse plane at the Larmor frequency. So the final call is that the result of resonance is that the magnetic moment of the hydrogen nuclei within the transverse net magnetic vector moves into a phase with each other. So now comes relaxation. So RF pulse जब हम निकाल लेते और RF pulse जब बंद कर देते तब होता है relaxation. So during relaxation, hydrogen nuclei give up absorbed radio frequency energy and the net magnetizing vector returns to magnetic field B0. And the relaxation result in recovery of magnetization in the longitudinal plane and decay of the magnetization in the transverse plane. The recovery of the longitudinal magnetization is caused by a process formed T1 recovery, and the decay of transverse magnetization caused by a process termed T2 decay. So we will further know why T1 is called recovery and T2 is called decay. So here is in a simple sentence, the process by which hydrogen loses the energy is called relaxation. So now coming to the T1 recovery. So what is T1 recovery? The nuclei giving up in T1 recovery, nuclei giving up their energy to the surrounding environment or lattice, and it is also termed as spin lattice relaxation. Herein you can see the graph also. And why it is called recovery? Because T1 relaxation results in the recovery of longitudinal magnetization due to energy dissipation to the surrounding lattice. Now what is T2 decay? So T2 decay is caused by nuclei exchanging energy with neighboring nuclei, and the energy exchange is called by magnetic field of each nucleus interacting with each neighbor. And why it is called relaxation? So why it is called decay? Decay. So why it is called decay? T1 relaxation result in the loss of transverse magnetization due to interaction between the magnetic fields of adjacent nuclei. That is why it is called decay. Now coming to the special encoding. So there in the MR machine, there are some magnets. The magnet can be divided into three parts: primary magnet, gradient coils, shim coil. In primary magnet, there are permanent magnet, electromagnet, superconducting magnet, hybrid magnets, niche magnets. Each have their फीचर्स ऑल्सो. अलग अलग जो मतलब टाइप है इधर मैग्नेट का, तो उसका अलग अलग फीचर्स है. वो हम डिस्कस नहीं करते। तो स्पेशल एनकोडिंग क्या होता है एमआर का? सो मैग्नेटिक रिजोनेंस इमेजिंग जो होता है, उसका जो स्कैनर होता है उसमें स्पेशल एनकोडिंग ऐसा चीज़ होता है जो एमआर सिग्नल इज व्हेन द एमआर सिग्नल इज अकम्प्लिश थ्रू द यूज ऑफ मैग्नेटिक फील्ड ग्रेडियंट्स that spins from proton is different location pieces at slightly different rates, and the portion of gradient coil, I already said there are primary magnet, gradient coil and shim coil. So the portion of the gradient coil and the associated current that is perpendicular to the main magnetic field is cause a force that is also called Lorentz force on the coils. These gradient coils are very important. This gradient are turned on and off very quickly in this process, causing them to vibrate and producing the majority of the acoustic noise during MR imaging acquisition. You can see the special encoding here. I can zoom for you. So this is the machine, and this is also, here is the table, and the patient is also inside the board. You can see here in this image radio frequency coil here situated, and the gradient coils are here. You can see gradient coils, magnets are here, and this is the whole scanner here from where the image acquisition is processed. And this is the axis wise, this is the Z coil, this is the X coil, and this is the Y coil also. And this is the transceiver here. You can see this is the transceiver, and this is the patient. You can see this is the transceiver. This is the process of spatial encoding. So now coming to the signal acquisition. When using magnetic field gradients, the obtained NMR signal contains different frequencies corresponding to the different tissue spin positions and is called the MR signal. You can see in this diagram. So here you can see in the image there is the RF source, that is radio frequency source, and then there is superconducting coils, there is RF reception coil, and there is excitation coil. Both the coils are situated in their respective way, in side by side, not side by side, it's against each other. So then then when the RF excitation is given, then the excitation reception coils is there. So the excitations are received there, and then the radio frequency receiver is there, then signal conditioning, and there is computer for control and image reconstruction also. So the MRI images is formed digitally, is a mosaic of pixel, and each pixel has two properties, character and position, and the character refers to the pixel intensity on CRT or film. White is assigned with high signal intensity and black is assigned to those pixels having low signal intensity. So producing an image from signal requires that a specific slice within the patient body is examined and voxel be designed within the slice. So that is all from my video. If you like the video, please subscribe the channel and also like the video and share it. So thank you guys.